Good evening. I'm Eugene Chan, and we are on Straight Talk, speaking with Dr. Libby Lee, Under Secretary for Health. Prior to her current appointment in July 2022, Dr. Lee was the Commissioner for Primary Healthcare, and she has been with the Hospital Authority since 2008 in other leadership roles, including Director of Strategy and Planning, Cluster Chief Executive, and Head of Patient Safety and Risk Management. As a specialist anaesthetist, Dr. Lee has served on various professional bodies, including the Hong Kong College of Community Medicine and the Hong Kong College of Anaesthetists. This evening, we will be talking about the securing the well-being of Hong Kong people. Welcome, Libby.
Thank you. Thank you for inviting me here.
Dr. Lee, we know that Hong Kong is renowned for its high-quality healthcare system. How would you describe the overall state of the Hong Kong public healthcare system as of today?
Okay. As a Hong Kong citizen, I'm very proud of our Hong Kong healthcare system in two ways. One is actually we are running a very efficient system in Hong Kong. Like we're talking about, we are the second or the first in the Bloomberg according to the efficiency in the healthcare system in Asia. At the same time, we have a very good reputation among the overseas, basically because of our services and research as well as our education. So we are proud of our healthcare system. And Hong Kong is actually running a model that is actually being envied by many countries because we have a very strong presence of the public healthcare system or public hospital systems in the society. So people can seek services either in the public systems or in the private sectors. So I would say we are doing pretty good in terms of healthcare service provision.
Right. So, Dr. Lee, I mean, as you said, as a Hong Kong person, we always prided ourselves on just a high quality and most importantly, accessible sort of public healthcare system. But what do you see as our sort of major challenges right now?
There are plenty. First of all, is some external factors like aging population we all talk about. In 2030, basically 1/4 of the people were more than 65 years old. And another one is actually the advancement of technology and medical services. It will add burden to our financial cost for the healthcare service provision. The third one is about the manpower resources, but this is a global issues. In every kind of healthcare systems, doctors and nurses are really crucial as a providers, but they're really running short of it, partly because of the low birth rate and partly because of the escalating healthcare services demand.
Right, Libby, we know that the Hospital Authority actually runs 43 public hospitals, and maybe you can give a sense of the scale of the services that the HA is providing, such as the number of hospital beds or even number of staff. I mean, how big is your sort of workforce in the Hospital Authority?
Okay, Hospital Authority running around 90% of the total inpatient services in Hong Kong and running about 30% of the general outpatient clinic. But we only have half of the doctors in the healthcare system, like 7,000. And we are also around 20-something thousands of nurses in the Hospital Authority. But each year, basically, we are running like 2 million of A&E attendances. We are having around 26,000 beds, inpatient beds in the systems, and operating 24 hours per day.
Wow. I mean, we understand, you just said earlier, that 90% of the inpatient care is handled by the public sector. Say about 40 to 50% of doctors are within the public system. So what kind of pressure will this, is an obvious imbalance, will create?
Two things. One is the push factors. The heavy workload in the inpatient services in the hospital will actually add additional burdens to the burdens to the healthcare providers, and pushing them might be the thing of, oh, life is so busy, maybe we can actually go to private. And also, it's also creating challenges to the service seekers, the service users. The waiting time may be prolonged because of the heavy workload compared to the limited amount of manpower. And so this is not an ideal situation to provide accessible and sustainable services.
Right, Libby, since you mentioned all that, but we are very lucky. We are blessed with one of the world's longest life expectancies. But as you just said, in a few more years' time, 1 in 4 Hong Kong's adults will be over age 65. How would this sort of will sort of put more pressure onto the system?
With people with more, people more than 65 years old, we have looked into statistics internally. Aging people, elderly persons using the healthcare services much more than people less than 65 years old. This is actually quite obvious, right?
Yes.
And so the strategies of our bureau, of the government, is to actually maintain good health of our people. If you are healthy today, stay healthy and prevent having any diseases. If you have diseases, just treat it as early as possible to minimize the effect of complications. And if you, unfortunately, have long-term diseases or complications, we want to make it sustainable for you. Right. So this is our strategies.
Right, maybe that's why we are also pushing the primary health care as well. Yeah. So let's look at sort of a recent reform that has been brought up by your bureau on the fees and charges reform. I mean, before we go into any sort of details, look at the big picture. It says it sort of aligned the principle of targeted subsidies. And I'm sure a lot of people may not have realized 97.6% of the charges that's actually incurred in the hospital is being subsidized by the government, sometimes even to 100%. Simple question is, can we afford it?
The short answer is probably we are not going to afford it in the future. If we're doing things like this continuously, what will suffer is our next generation, maybe our children, or maybe when the young people getting old, they will suffer because this healthcare system is not sustainable. And then basically, I would say if we do not do something right now, the health of our people will getting worse and the system probably will collapse as well.
Right. Libby, I'm sure you understand other healthcare systems as well. How fortunate is Hong Kong people? I mean, getting 97.6%, even close to 100%, except some medical devices or sort of those you have to pay for yourself. Would you say we are one of the very fortunate population?
I say so. I think so. And so that's why I say, as a Hong Kong people, I'm very proud of our healthcare system. Think about countries nearby, the maximum subsidization. They basically, in their own country, the most underprivileged group, the government only subsidized 80%.
Right.
But in here, we actually, for the most underprivileged group, we subsidize 100%. And for normal people in other countries, probably they subsidize around 20%. But in average, we are currently running 98%. So, and mind you, we have a very low taxation system, actually, in Hong Kong. So how to maintain the low tax and also a high quality healthcare system, we need to think about it.
Right. Libby, I mean, I was going to ask you about this reform. I mean, I've read under different principles you're trying to achieve, saying that strengthen the healthcare protection, rationalize the public service subsidies. One very important thing that catches my eye are reduce wastage and misuse, and also enhance sustainability. Can you explain to the viewers along those lines?
All right.
What are you trying to do, and why do we have to increase charges? I'm sure people will know that we have been subsidized too much, but it looks like the underlying principles have gone much deeper than that.
Thank you, Eugene. I'm very glad you start this interview. You talk about the global thing, the strategy behind first. Fees and charges is just a tool for us to how to make our healthcare system sustainable. In terms of sustainable, we also want the right people being treated in right place with right care. So that's why we try to use different kind of tools to do that. Before fees and charges review, basically we promote primary healthcare. We set up the Primary Healthcare Commission. It's one of our strategy to actually do the healthcare reform. The healthcare, the fees and charges restructuring, we want to focus or subsidize more on those who are really in need. For example, those are underprivileged, those are in very acute cases of critical and serious. And about misuse or, wastage, that kind of stuff. I want to clarify one thing. Resources allocation to healthcare system is not only about funding, but it's also about manpower and also physical facilities, that is the hospitals, the beds, etc. If we focus on one area, for example, we have a lot of A&E attendances, all the resources, including manpower, the beds, the places, will all go to A&E. And resources allocation is always a zero-sum game. That means we put people in A&E, there will be less people in other specialty. For example, people unavoidably will suffer from long waiting time from other specialties like cataract, total joint replacement. So we want to make it a balance and ask our people to help us to make it a balance so that we can provide timely services to our people.
Right. Thank you for sort of explaining it. So I think this fees and charges reform is a lot more than just increases the actual fees. But actually, I've sort of looked at the reform proposal. It looks like over 1,000 charges have been reviewed. And for example, visiting the A&E department, as you just mentioned, has doubled from $180 to $400. The specialist outpatient actually tripled from $80, which is very low, to $250. And the hospital inpatient charges will go up 2.5 times to $300 a day compared to $120. While we understand that all this is needed to be done, we also have to face with increased energy charges, increased public transportation. I mean, our public housing estate is going up, also increase in rental. And with this sort of downturn in the economy, it's going to be pretty tough. Do you have any sort of fees waiving system inbuilt in this?
Oh, yes. As I said, our fee and charges are restructuring. We want to focus on the underprivileged, serious, critical, and acute cases. So at the same time, we introduce a waiver system and also a capping system. The waiver system is we assess, the patient's monthly income as well as their asset, and we have a scales, and then we can basically have a total waiving or partial waiving. At the same time, if a patient unfortunately using a system and then they have to pay more than $10,000, there will be a cap of that. Of course, the patients need to apply for this waiving system and also the capping. And the other things is quite different from other fees and charges. Just adding the fees and charges, we try to restructure it. In order to just adding the fees, we're also doing itemized charge.
Right.
That means when you need more, you need to pay more. But so that when unnecessary needs, you probably need to pay, and people will tend not to pay for it, and they will reduce the unnecessary needs. So this is kind of concept at the behind, so to make well use of the limited resources.
Right, Libby, let's take a short break now.
Yep.
But viewers, stay with us. We will be right back. Welcome back. Dr. Libby Lee, Under Secretary for Health, is with us discussing how the government is securing the well-being of Hong Kong residents with reforms to our public health system. Libby, you had very clearly explained to us the rationale behind. It's not just increasing the charges, but we're trying to reform the whole system so that everything can be sustainable. But just looking at one of the report from South China Morning Post, they said that although you mentioned there will be a cap on the money spending on like $10,000, they use an example of somebody with chronic illness. Say they might see a specialist every month. There's $250 per visit. There's already $3,000 a year. And occasional go to A&E if they feel uncomfortable, have to stay in the hospital and all the diagnostics. So it's easily reaching that $10,000. So if a person making like $30,000 to $40,000 a month by himself or with the family, that's, I'm sure, above the one that had all the subsidies, that's really stretching it, especially living in Hong Kong with a rented flat, and even worse so if he is the primary sort of income earner. So how can you help these sort of missing out all the waiving systems patients? How shall they sort of face this increasing charges?
I would guess there are 3 points that are helping them. First of all, the waiver system. The current waiver system we are having right now, we will try to extend all the criteria so that the safety net will be much bigger to cover people. Because people, if they really want to have a waiving system, they could apply and look at our income and also the exit management. The exit amount is actually much exceed the current time. And also we have changed the definition of family. So anyone who is single and more than 80 years old, we were at 18 years old, basically we count it as one family, one person family. So they can actually apply for the waiver individually without actually sticking to the family. And this is one point. The other point is actually about the capping. If a chronic disease patient basically come in to use the services and the fees and charges is more than $10,000, they're very welcome to apply for the capping. And so beyond the $10,000, they will not need to pay. Thirdly, it's also about waiver system. Our waiver system is not only looking at the financial terms, but also non-financial terms. If patients really have needs, and also because of the complexity of the disease, they can always access to our medical social worker to assess for non-financial terms waiver system. So I hope that this group of people, basically our target group. We really want to help them.
Right. I mean, the hospital authority, Dr. Koh, has said this public co-payment ratio will remain affordable even after the reform, not only looking after the underprivileged, but also the middle-income people. So can we still maintain the concept that I've always had, that in Hong Kong, there'll be nobody will be denied any medical care due to financial means? Is that underlying principle still apply after all this?
Of course, definitely. We'll talk about it. We look into our data. We look at our patients in attending our general outpatient clinic. Normally, say average, they take 4 drugs a month. Even with the new system with itemized charge, drugs $5 per 4 weeks in general outpatient, that means that person will pay $20 a month for the drugs.
Excuse me, did you say $20 Hong Kong dollars?
Yep.
That's pretty low.
Yes, think about it.
For 4 drugs?
Yeah, think about this is less than $1 per day. So this is the concept about we want people to invest in their own health. Instead of spending that $1 in anything else, maybe we can stop and think about it. Could we actually invest it into our health? So this is, again, a kind of reform that we want to do, that is changing this health-seeking behavior.
Libby, I have also looked up some of our government spending expenditures. It's that in public health care, it definitely has increased actually quite significantly over the last decade, from 70 billion in 2015 to 16 to now projecting to current financial year $141 billion, which is equivalent to 90% of the government recurrent expenditure, only second to social welfare. But at the same time, our government reserves has depleted from 1/3, from 1.1 trillion before the pandemic to about 674 billion right now. So is this initiative trying to attempt to cover some of the financial deficit? Or has this reform, it's just been overdue for too long, because a lot of people say, even just now when we were in the makeup room, they say it's very cheap in Hong Kong for medical care. Under what direction are we doing right now?
I would say it is definitely not for covering the deficit, because the government committed whatever we actually earn from these charges, fees and charges review, we put it back into the healthcare system. So to help more people, like people having self-financed drugs, etc. So it's definitely not covering the deficit. Why we are doing this is just because earlier we are facing a lot of challenges in the healthcare system. If we do not try to intervene right now, basically in our next generation, or like in 5 to 10 years ahead, basically our people will not be having a sustainable or affordable healthcare system anymore. So that's why we think this is timely to do it. And again, the fees and charges review, we did it actually every 2 years. And so this is just a good time, appropriate time to look at it, and we will review it in 2 years' time again.
Right, Libby, just you mentioned the word sustainable. I think sustainability, I'm sure, is a word that everybody sort of treasure that what Hong Kong has. So with this sort of upcoming reform and all that, it's kind of affecting everybody in a way, because everybody is eligible to go to public system. How are you going to build support from the community? How are you going to engage the people? Because sometimes, especially the younger generation, they may not be as well informed. And having said that, we need them to support the system by looking after their own health. How would you sort of engage to the community in a even more efficient manner?
A very good question. I always think that healthcare system or hospital should not be situated top on a hill. They should be part of the community. And community are always our partners. So there are different forefronts for doing this. First of all, we will try to basically work closer to the primary healthcare system, because the primary healthcare system is a very good community network. If we can actually have a good relationship with primary healthcare, the patient journey from the primary healthcare to secondary to tertiary will be much smoother. So that this is one point. The other point is actually we try to engage a lot of community partners, including patient groups and also different NGOs, volunteer groups, to understand a bit more of our healthcare systems and policies and try to work together for some specific targeted group. I think continuous engagement with our community partners is very essential, especially when we talk about a waiver system. It's really a complicated one. It's difficult to just explain one time. Probably we need to have an ongoing dialogue on that.
Libby, and just we mentioned about other neighboring cities or countries, they're subsidizing like 80%. Will other countries face similar problems like us?
I think we are facing the same problems. So you will see that different countries also have initiatives promoting primary healthcare, preventive medicines like anti-smoking, exercise, that kind of stuff, anti-alcoholic, that kind of stuff. We are all facing the same thing. What actually fortunate for Hong Kong people is that we already have quite a robust mechanism over here. If we try hard together, I mean, the healthcare system providers as well as the users and also the healthy people, if we work together, I think that's a bright future for all of us.
Right. Libby and I, as we mentioned earlier in our interview, that we are now subsidizing like 97.6 to even up to 100% in terms of subsidies. And our plan now is trying to bring it down to like 94%. And hopefully in 5 years down to 90%, because these fees and charges will be reviewed every 2 years, as I read. So this is just the beginning. Can we still afford at 90% subsidies to the system? It's still very high compared to the 80% that you mentioned.
We always think Hong Kong people are clever and smart. Yes, you look at neighboring countries, it's actually subsidization, the maximum will be 80. Most of them is at around 20 to 50. But we're still running a 90% subsidization with low taxation. At the same time, we try very hard to improve our efficiencies on top of our already very efficient service. We hope that we can actually, from that, we can grip a bit more, but apart from just changing the fees and charges.
Right.
And also introducing primary healthcare, working with the community, preventing preventable disease are very important. We hopefully in the future we can decrease the healthcare burden by that.
Looking ahead, what gives you confidence that we can build a stronger and fairer healthcare system for all of us?
I think one factor is actually, the human heart or our minds, both from the providers and also our patients and also the citizens. We have SARS, we have COVID, we all understand health is an essential element. But just how to make this understanding, this belief into exercise. So I think we can work together to make it a healthy Hong Kong.
Thank you, Dr. Lee, for sharing with us all the changes ahead. That with our population aging and healthcare needs growing, these reforms are about future-proofing the well-being of Hong Kong people, not just for today, but for the next generations. Until next time, I'm Eugene Chan, and thank you for watching Straight Talk.